options, where to go. And I know when you saw her last in June, gosh, so much has happened since then because you've had so many hospitalizations and things happen with your heart that it's kind of stole the attention away from the cancer side of things. But she was talking about, you know, when we were talking about treatment options, what there is for us to do at this point. And really, I don't think that there is anything that, first of all, that you could tolerate that we wouldn't hurt you with more than help you, besides the Tarceva. Now, I know, and you tell me a little bit more with the pills what happened, because I just heard through Lynn and through Dr. Ross that that wasn't a good experience for you.
Yeah.
No?
So horrible.
Horrible.
I've got to show you, Lindsay.
Yeah.
This is what I'm experiencing, although it's even better than...
Oh gosh, all the dry skin?
That's Tarceva.
Oh wow.
It's, you know, flakes. I have flakes everywhere. I mean, this is nothing, you know.
Oh gosh,
all over my stomach there's...
What have you been using?
What's it called?
Cetaphil.
Cetaphil.
Okay.
But
I mean, I'm sure it's just hard to even get back that moisture that's there. I mean, what Dr. Ross was talking about maybe trying to do was to have you take half the dose and see, but I don't know if it's something that you even want to do with that. I mean, and I guess at that point the question is how much benefit is that really providing at this point?
There was no benefit at all. It was a minus.
well, it didn't seem like
She
it.
was
You know,
sick every day. She was having diarrhea every day, nauseous every day.
Diarrhea too, yeah.
All these,
Was the rash, I know that the flaking's there, but was the rash bad on your face too? Did you get that acne
see,
type
I'm
rash?
almost getting that more now.
Are you?
I've got and up in my up in here.
Yeah.
It just
And boy, it doesn't look bad to me, but I mean maybe a little bit of the dryness there, but not that acne rash. But it maybe is worse than what your skin normally is, you know.
And she didn't have that acne type rash.
Yeah, that didn't come up.
That's worse, but this is pretty bad.
Well, that definitely the dryness is. I mean, and the flaky. There's no question that.
yeah.
And especially if you didn't think that it really provided any added benefit with it.
Well, I know it didn't do much for the nodule in my lung.
Yeah.
Now maybe it helped to stabilize.
Yeah, I mean, I don't know. There's been, every time there's been an issue from your cancer, I feel like it's been all associated around this lymph node and the blockage there. I mean, and all the radiation that you've had to the area. And so I don't know that, other than giving you more toxicities, that it's going to bring a lot of, that it's going to add a lot. And especially if it makes your quality of life worse, then I don't know that it's worth it, you know.
Yeah, that's what I'm thinking
Now,
too.
are you familiar with the tamponade that she had?
Yes, well, at least I heard about it from the hospital stay, yes.
Okay, and so now that is caused by cancer.
Well, by the fluid, yeah.
So the stay in the hospital was cancer related.
Well, now I guess I would have to go back and see. Did they drain when they did they
Yes.
test that fluid?
Yes.
They did. Did they find cancer cells there?
I don't think so.
No.
I don't think that from what my knowledge from talking to Dr. Ross, that was just, I mean, it may have been from radiation and from other treatments causing that fluid to build up around your heart.
Yeah.
Sometimes when they take that fluid off, just like when we take fluid off your lung, we can find cancer cells that are there. From my understanding, I didn't think that there was any cancer cells involved. I mean, not to say that your cancer hasn't been a part of all of this, because I think it's been the numerous treatments that you've had that have led to some of these complications. But that necessarily I don't think was caused because the cancer was active, attacking your heart right then, you know, or causing that fluid buildup. You know, and with some of that now, when they sent you home, had this cardiology, I saw you have a couple of follow-ups set up, but I don't know, did they do anything further? did they change
I mean,
medications or
We don't have
anything?
any setups with
We haven't had
cardiac
any
people.
follow-ups.
Okay,
This
They
is the
said we
latest.
were going to.
Okay.
This is our latest itinerary, and it doesn't show that there are any follow-ups with, there's palliative follow-up is
Okay.
about all there is.
well, let me see too. One of the things Dr. Ross and I talked about was having a follow-up with her the week of September 10th. The reason why we were talking about having it in a couple of weeks, well, it'd be about a week and a half or 2 weeks from now, was to see first of all how you were doing, okay, check on you after having a little bit more time from being out of the hospital. And also we talked about if we wanted to restart the Tarceva. You tell me if I'm incorrect, but it sounds to me like that isn't even
It's not
anything
gonna
you
happen.
want to do. Yeah.
No,
Okay.
I don't think
And that's okay, but I just wanna make sure that we're on the same
I don't know why anybody
page.
uses it, to
Yeah.
tell you the truth. When you read up on it, it's all negative, nothing positive at all.
You know,
There are some
Yeah.
positive findings to it, but
Not minuscule.
It works for
And
some people.
Just a few
not
people
everyone.
get benefit out, maybe 3 out of 100.
yeah, if you have the mutation, it definitely has more benefit to it.
But see, also at the same time, she was having radiation, which actually I think caused it to be much worse than it
Yeah.
should have been.
And, you know, it's hard when you have two treatments going on at the same time because you have 2 different side effects that can come up.
Right.
And so it's difficult to know if it was just both the side effects to each treatment or whether one fed into the other one, making it any worse. It's possible. Anytime you have chemo and radiation together, it can be hard. You know, Tarceva is a targeted therapy, and so it's not chemo. It's a little bit different, but doesn't mean it doesn't come without side effects, and obviously you've gotten to see that, and everybody's a little different with how it can present. Some people do have terrible side effects to it, and some people it actually improves their symptoms of the lung cancer. And
Well,
so
the
they can
radiation
keep
worked
up.
real well.
So
But
You
I've
see the
seen people that
results
have
of
been
that?
on for 4
Yeah.
years
yeah,
and
Did
more.
you see that,
Yeah.
Lindsay, the results of the radiation?
yeah, you know.
Dr. Ashman said that it practically dissolved the whole.
Well,
tumor.
it shrunk.
Yeah, I mean, and every time that you've had radiation, it's helped. You know, I think that's really allowed us to continue on and allow you to have breaks, even when you were getting a lymphoma in between there. You know, you'd have radiation for a while, and that kind of keep things calm for a while, and then if things started to grow or show up differently on your skin, we would start some of the chemo again. But you know, the hard part is that the side effects, just like with your heart and some of these other things that, you know, could have maybe been triggered by some of that too. And it's hard because if we don't do the treatment, then the cancer gets worse. And so, you know, it's trying to
Yeah.
balance everything.
That's where I am, and I was thinking, you know, I would just go, you know, because I'm like this right now with
Yeah.
the blood clots, the Lovenox,
Yeah.
and all that, you know, whether or not this would come back.
Yeah.
And,
I mean, tell me what you're thinking about stopping the injections.
No.
No, okay.
But if this should appear again, you know, the blood sac under the heart,
Yeah.
I don't think I could do that again.
Yeah.
So I'm feeling like I've got to just give as well as I can and see
Well,
what happens.
And I think that truly right now, to try to just help take care of symptoms and see how you're doing right now, you're not in any state to have any other treatment, even if it was indicated. Right, there really isn't anything that's indicated to use, but I think you've been through so much that strength and all of this stuff, we need to just work on keeping you comfortable and trying to get you to feel a little bit stronger. And you know, I think it's okay that if we set up another appointment, like I say, in September, and have that appointment with Dr. Ross and see how you're doing. Now, hospice has been coming out to the house already, right? I mean, I don't think that there's any reason to stop the care that you've been having, because if we're not doing chemo or radiation, you know, to have the added help and to have them there, that's just an added bonus. It doesn't stop us from taking care of you, just like today. It doesn't keep you from having to come in here. Dr. Ross is still involved, even with having the doctor come out for the wound. I mean, we're still involved with everything. So if it was a disconnect where all of a sudden then you had to stop seeing us, I can see where that would be a harder decision. But at this point, since we're not doing any other treatments, I think that that's probably the best thing for you right now anyways.
Yeah.
And then we can just take it one day at a time. You know, I don't know. I don't know how this is going to progress. I don't know what will be the next thing to show up. To be honest, a lot of your complications have been, like I say, related to your heart and to other things that have happened, and possibly because of your treatments, but not necessarily because the cancer has caused you to have more shortness of breath or things like that.
Well, you know, and so far it hasn't gone to my liver or other places like that, you know.
I mean, and you tell me, but my bigger focus is wanting to make sure your quality of life is good.
And that's
She's getting
what I'm
better,
looking
Linsey,
for.
a little bit every day. She made a miraculous recovery.
Yeah, well, everything that I had been hearing was that you were really having a hard time breathing and just really in a lot of pain from everything. And so I think the hospital stay was a good thing. I mean, I think it helped as far as symptoms.
Definitely helped. Made her
and they've helped a lot with nutrition. And my daughter's
She's the nutritionist.
Hey, that's good.
I'm not a nutritionist.
Family nutritionist.
No. Believe me, I am not. I just do camera stuff.
I asked her when she was going home. She's thickening this.
You were trying to get a little junk food in there, or what?
No thickening.
Yeah, when she does not like me thickening the liquids.
Oh, yes.
And I'm like, Mom, that is a must.
Because you know that thickening means something else is going in there, huh?
Yeah.
But you're right. We should have and like to have an appointment with Dr. Ross.
Yeah, we can do. I think that that's a good thing. I think, you know, today was kind of set to see how you were doing out of the hospital, make sure you were okay, make sure there wasn't anything from a symptom management standpoint that we need to do, but it doesn't sound like pain-wise, I mean, everything sounds...
No, and the incision, that seems to be healing.
Yeah.